While we're waiting for the slides to come up, I think what I'm here speaking on behalf of Alberta Health Services is to talk a little bit about how we can learn, take some of the learnings from the area of tobacco control. That's my area of expertise, and use those learnings as we look at legalization of cannabis. So sorry for the advance. Is it?
Oh, here comes Colin.
Great, thank you. Okay, so there's three challenges that I wanted to put before you, and one is can we use the cannabis regulatory framework to support measures to be taken to address the harms related to tobacco and alcohol. I think you've heard from other speakers through the course of today that we're not doing a particularly good job at the present time in terms of regulating the harms in those areas. So can we, as we put in a regulatory framework for cannabis, address some of those gaps? Second, is there an opportunity to address the current tobacco alcohol revenue funding paradox? Dr. Wild showed you in terms of the amount of money that was coming in from tobacco and alcohol revenue and the minuscule amount that is being expended in terms of for prevention, protection, and treatment services in those areas. And then finally, there's a document, a global document, the Framework Convention on Tobacco Control, that sets out guiding principles to help reduce the burden of disease caused by tobacco globally, and are there aspects of that that can be applied to cannabis? Again, just showing the impacts of substance abuse, in particular alcohol and tobacco, and how they outweigh other drugs. Dr. Wall had showed this curve as well. I'm going to just, and it's that balancing in terms of regulation versus deregulation as far as minimizing the harms with that public health approach. What I wanted to show was some specific issues that we're dealing with at the present time in tobacco and alcohol and how they might inform us for cannabis. So if we look at proposed federal legislation, it's identifying age 18 at a federal level for purchase of cannabis. There is the options for provincial governments, and depending on the provincial legislation, municipalities to go with a higher age. In the tobacco area, we have established a goal. The current federal Health Canada strategy for tobacco, which is under review and renewal right now, is establishing a use of tobacco nationally of less than 5% by 2035. And one of the measures in that plan is looking at increasing the age for purchase and possession of tobacco to age 21. That's something that's occurred in 2 states in the U.S. and over 300 cities. So we have this interesting situation where we're going to be potentially increasing the age for purchase of tobacco to 21. At the same time, cannabis is at age 18. The next is the current provincial legislation prohibits water pipe lounges. And again, in the global, is we're looking at a strategy which we would potentially ban combustible tobacco products as lower harm tobacco products come into existence. Use of vaping devices, a harm reduction strategy, is that you would ban or eliminate combustible tobacco in the next 5 to 10 years. And at the same time, the federal legislation creates the opportunity or identifies the possibility of allowing cannabis lounges and sampling. And so again, we've got this disconnect between what we're wanting to control harms on one side versus what might be considered under the cannabis legislation. We're also looking again for much stricter licensing of tobacco establishments, requiring tobacco retailers to undergo licensing, training, looking at the possibility of putting in place manufacturer distributor licenses for tobacco firms to help capture some of the costs or harms associated with tobacco. And so does that, how does that fit with restricting retail sales or the number of stores, venues for being able to purchase cannabis? And again, reference has been made earlier to the low-risk drinking guidelines. So again, we know as the number of retail liquor stores are increased, there's an increase in terms of consumption of liquor. So how do we ensure that balance in terms of the number of stores, siting of stores, to again minimize potential harms? These are some slides just in terms of from Colorado, which has gone that commercial route. And so you can see the looper, the bus, Greyhound-looking bus in the corner. That's a cannabis lounge on wheels. And that, there's the inside of the bus. And they just recently had a dabbing event in terms of that, where they were testing the high-potency cannabis products in terms of up to 90%, 85-90% THCs. The Toast cigarette container in the bottom is an example of a combined, it's promoted as a luxury cannabis tobacco blend cigarette. Fortunately, that's something that is prohibited under the federal legislation, along with the also mixing cannabis with alcohol. The Paradox funding. So just again, that we don't want to get a situation created with cannabis that we've seen in the areas of alcohol and tobacco, where the revenues that are generated from these areas go into general revenue, and there's no commitment to expend them in the areas of services, direct services related to those. So if we look at what's happened in the tobacco area, as since 2008, we've seen per capita expenditures on prevention, protection, and treatment services, cessation programs, has decreased from $3 per capita in Alberta to $1 per capita. Centers for Disease Control suggests $15 per capita in terms of for optimal tobacco reduction programming. At the same time, tobacco revenues have increased by $152 million. Look at the situation for alcohol. There's a net deficit in terms of the expenditures related to alcohol costs compared to the amount of revenues that are generated. So again, the importance of getting that revenue figure correct and having it dedicated to those prevention protection services. Final comment in terms of the Framework Convention on Tobacco Control discussion in terms of from Mr. Kilmer around the commercialization. One of the biggest challenges with the tobacco area is the active lobbying that's done through commercial tobacco companies and also through their retail affiliates. So the Canadian Convenience Store Association very actively lobbying at a federal level right now against plain packaging. And this clause requires that their governments take action to protect or minimize the opportunity for commercial interests to affect the legislation that would be put in place to minimize public harms. I think that this is just some of the steps. We actually have, I think from a legislative perspective, There's measures of under the existing Provincial Tobacco and Smoking Reduction Act that actually would provide good protection against environmental exposures to cannabis smoke in public places, and that if they were proclaimed would provide protection. And then, as I mentioned, the need for us to look at a strategy for how we're going to fund the required prevention, protection, as well as the research and surveillance activities that, again, we heard were important from other speakers. Thank you.